I'm here today with Dr Naveen Somia, who's a specialist plastic surgeon practicing out of Vista, New South Wales in Sydney.
And Bondi Junction.
And Bondi Junction as well, and Bondi Junction. And we're going to have a bit of a chat about blepharoplasty. It's one of the procedures that he's renowned for, and we're going to just sort of sift through a bit of the Medicare information for you as well. So thank you so much for taking the time today.
Thank you, Trish.
So tell us a little bit about the blepharoplasty and Medicare. Like, I've got a lot of people that contact me, they've been to the doctor, they've got to go and see someone to get their eyes fixed, and they're like, well, who do I go to and what am I going to be covered for? So shed a bit of light for us, would you?
Yeah. Blepharoplasty or upper eyelid surgery is viewed as functional if it meets certain stringent criteria.
Right.
And the stringent criteria are such that if the eyelid is malpositioned, or there's an abnormality of the eyelid, or there's an abnormality of the excess eyelid skin that actually covers some of your field of vision.
Yeah.
So it is not just a cosmetic appearance thing, it has a functional importance as well, because impaired vision is always a functional limitation to the patient. So these are two conditions, and of course if you have a droopy eyelid as well. So these are two conditions where the blepharoplasty or upper eyelid surgery is viewed as medical as opposed to cosmetic, and hence will attract some Medicare benefits, which in turn will mean that if you are covered with a private health fund, depending on the level of your cover, you may get some private health cover, which will enable you to have this operation in a private hospital with some financial benefits. Eyelid operations that are treated are done for repairing cancer defects, trauma defects, or treating eyelid conditions due to any congenital deformities are obviously viewed as functional, not cosmetic, and hence they do attract Medicare benefits.
Okay.
Conditions like inward turning or outward turning of the eye, like also known as entropion or ectropion, also attract also attract Medicare benefits because they are viewed as functional as opposed to cosmetic.
Okay.
Lower eyelid is never functional unless it has either entropion or ectropion, or is it a cancer or trauma defect. Okay?
Right.
So aging of the lower lid does not attract any Medicare benefits, viewed as a purely cosmetic operation.
Got it. So if your skin is really loose on top and you can't see and you've got a problem with your vision, that is classified as having an item number, but the bottom, definitely nothing ever. All right, great. And so say, for example, with an item number, if someone comes to see a specialist plastic surgeon, they're not covered for the, what are they actually covered for?
So Medicare item number means that Medicare recognizes that this condition is non-cosmetic and hence medical.
Yep.
So if in the event of you having an operation in a private hospital, provided you have private health cover, your hospital costs gets covered to the extent your fund will cover you.
Right.
The other factors involved in the cost are your surgical fee and your anesthetic fee, which vary from provider to provider, and that is something that you can find out when you go and see your specialist surgeon. And Medicare has a small amount of payment for that, and there's invariably a gap, which will depend on your surgeon.
Okay, great. All right, excellent. So basically, if you've got private health cover, you're going to get covered for that portion of the hospital and a portion of the needs, hopefully, and you'll just pay the gap between the Medicare rebate and the surgeon's fee.
That's correct.
Great, awesome. So hopefully that's cleared it up for you as well. Right.
Thank you.
So if you're in Sydney looking for a bleph, don't go past Dr Somia, and if you've got any questions or if you want a bit more information, drop us an email at info@plasticsurgeryhub.com.au. So thank you so much.
Thank you, Trish. Thank you for having me.